What if your body has a secret warning system and it's been at your fingertips this whole time? You look at your hands constantly, but have you ever really looked at your fingernails? That tiny spot, that little ridge, or a weird change in color could be your body's way of sending an SOS. These aren't just cosmetic quirks, they can be early clues to what's happening inside your body. Today, we're decoding 10 specific nail signs that should make you put down the nail file and pick up the phone to call your doctor. We'll explore what these changes mean from a medical standpoint so you have safe, accurate information. This is for your education, not a diagnosis. If you see any of these signs sticking around, the best move is always to talk to a healthcare professional. Number 1, dark streaks. One of the most serious, a new or changing dark streak. If you see a dark line, black, brown, or even blue, running vertically up your nail, you need to get it checked out and fast. While it can be totally harmless, this is a classic sign of melanoma, a dangerous form of skin cancer that can hide under the nail. Pay extra attention if it's only on one nail, seems to be getting wider, or the skin around your nail starts to darken. It's easy to dismiss it as a bruise from an old injury, but this is one sign you absolutely cannot afford to ignore. Number 2, nail clubbing. Have you ever seen fingers where the tips look swollen and the nails curve down over them? This is called nail clubbing, and it's a slow change that can happen over years. This distinct shape is often a red flag for conditions that cause low oxygen in your blood. It can be a powerful indicator of some serious underlying issues, including lung disease, heart problems, or even liver and gastrointestinal diseases. Number 3, spoon nails. Here's a strange one. Nails that are so soft and curved inward, they look like tiny spoons. The fancy medical term is koilonychia, and the nail can sometimes be indented enough to hold a drop of liquid. The number one cause for this is usually iron deficiency anemia, but spoon nails can also point to a liver condition called hemochromatosis, where your body has too much iron, heart disease, or an underactive thyroid. Number 4, nail pitting. What about tiny pinprick dents on the surface of your nails? That's called nail pitting. It literally looks like someone took a tiny ice pick to your nail plate. This sign is incredibly common in people who have psoriasis, an autoimmune skin condition. It can also show up with other autoimmune problems like alopecia areata, which causes sudden hair loss, or chronic eczema. Number 5, Beau's lines. Have you ever noticed a deep horizontal groove running across your nail? That's called a Beau's line. These lines form when something, like a major illness or stress, literally causes your nail growth to pause. Think of it like a ring on a tree trunk marking a rough season. This can be triggered by a serious illness with a high fever, a major physical injury, uncontrolled diabetes, or even aggressive treatments like chemotherapy. Number 6, yellow nails. Let's talk about nails that are persistently yellow. Sure, it could be staining from dark nail polish or smoking, but true yellow nail syndrome is a different beast. With this condition, the nails thicken, their growth slows way down, and they take on a yellowish tint. It can sometimes signal a stubborn fungal infection. In rarer cases, it's linked to serious conditions like respiratory diseases, think chronic bronchitis, or issues with the lymphatic system. Less often, it may also be associated with severe thyroid disease or diabetes. Number 7, pale or white nails. Normally, your nail beds have a healthy pink color, but if you notice they look very pale or almost completely white, your body might be trying to tell you something. This can be a sign of anemia, which means you don't have enough healthy red blood cells. It could also point to poor nutrition. There's also a specific condition called Terry's nails, where almost the entire nail is white except for a narrow pink band at the very tip. This particular sign can be a clue to serious health issues like liver disease, congestive heart failure, or kidney failure. Number 8, splinter hemorrhages. Do you see what looks like a tiny wood splinter stuck under your nail? These small, dark, red, or brownish lines are called splinter hemorrhages. They're actually tiny lines of blood. Now, you can definitely get one from an injury, like slamming your finger in a door, But if you see them pop up on multiple nails for no reason, you need to pay attention. They can be a warning sign of a heart infection called endocarditis or other systemic issues like lupus. Number 9, nail separation. The condition where the nail painlessly lifts away from the nail bed. It's called onycholysis or nail separation. The part of the nail that has separated might look opaque white, yellowish, or even greenish. While this can happen from an injury or a nasty infection, it's also commonly tied to thyroid disease and psoriasis. So if your nails are lifting off and you didn't injure them, it's a good reason to see a doctor. Number 10, brittle or cracked nails. And millions of people deal with nails that are constantly dry, cracking, or splitting. If this is a chronic problem for you, it could be more than just the result of frequent hand washing or exposure to chemicals. Persistently brittle nails can be a subtle sign of thyroid disease, hypothyroidism, and underactive thyroid. It might also indicate a deficiency in iron or certain B vitamins. Your nails are a fantastic window into your overall health. Paying attention to them is a simple, proactive way to stay on top of your well-being. Remember, seeing one of these signs isn't a reason to panic. It's a signal to have a conversation with a doctor or a dermatologist who can give you a real diagnosis. If you learned something new about your health today, hit that like button and be sure to subscribe for more credible health content just like this. And if you have a question, drop it in the comments below. We love hearing from you. Thanks for watching, and we'll see you in the next video. Stay informed and stay healthy.